In sort of keeping with the general pattern, we have a keynote speaker, and then we'll follow with a panel discussion from a number of people who are really working on practical examples that will give you a better understanding of healthcare reform and how it affects specific populations, as well as the examples that have already been alluded to from Massachusetts. So again, a really exciting afternoon. One of the things that people have talked a lot about is abortion and the Hyde Amendment. And so we're really excited to have Toni Bond Leonard come and present this afternoon. Toni Bond Leonard is president and CEO of Black Women for Reproductive Justice. Prior to assuming this position, she served as the executive director of the Chicago Abortion Fund for 7 years. She was the first woman of color to serve as CAF's executive director, and under her leadership, CAF gained national recognition as one of the premier independent abortion funds in the Midwest. Ms. Bond Leonard was one of the founding members of Women of African Descent for Reproductive Justice, a group of Black women who came together in July 1994 to organize a full-page signature ad in the Washington Post and roll call, demanding that Congress include the full spectrum of reproductive health care services, including abortion, in any proposed national health care package. This ad represented the collective strength of 836 Black women around the country. It was the members of this organization who coined the phrase reproductive justice, and you can see it's really had such traction as even part of the title of this conference. This group also republished the much celebrated We Remember brochure that voiced Black women's support of reproductive health and choices. Her personal experiences, knowledge, and understanding of the meaning of reproductive justice and equality in its broadest sense was the impetus for her co-founding the African American Women Evolving, now known as Black Women for Reproductive Justice. In December 2008, Ms. Bond Leonard was a part of a group of reproductive health, rights, and justice advocates who met with the President-elect Obama's transition team about advancing reproductive health and rights. In 2005, she received the Jane Bagley Lehman Fellowship from the Tides Foundation for her vision and years of activism in the women's movement. She's also a recipient of the Pauli Murray Award for the Chicago Now Education Fund in 1997, the Freedom of Choice Award for her years of service from the Chicago Abortion Fund, the Bella Abzug Woman of Achievement Award from Chicago Chapter of the National Organization of Women, and the Women in History Award from the Women's Board of the Chicago Urban League, the League of Black Women, and the Hookup of Black Women Chicago Chapter. So, quite a mouthful of her many achievements. So, join me in welcoming Ms. Bond Leonard.
Good afternoon, everyone. Every time I hear my bio, I'm like, who is that lady? It's great to see so many familiar faces here. I hear you all have been having a wonderful conference, and I wish I could have been here with you this morning, but everyone in my office is involved in fighting the good fight around these billboards here in Chicago. And so unfortunately, I can't even stay after I'm done because I got to go back and continue to fight the good fight. But first, thank you to the section of Family Planning and Contraceptive Research and the Center for Study of Race, Politics, and Culture for hosting this conference on reproductive justice and health care reform. This is an issue that I've personally been involved in one fashion or another since 1994 during the Clinton administration, which is when actually the term reproductive justice was coined by Women of African Descent for Reproductive Justice, which it was a mouthful and we just started to call it WADRA. But part of the reason why the group came together was because we were at a conference here in Illinois sponsored by the Ms. Foundation and the Illinois Pro-Choice Alliance. And of course, the topic of the day was universal health care reform and what was being proposed by the Clinton administration. And a group of us, Black women, there were probably about 8 of us out of 150 people at the conference, and we decided to get together and caucus and talk about what were the real issues and concerns confronting Black women, and what did any universal health care plan need to include. And so we came together and started talking about, what did it look like? As we think about what did healthcare need to include, it needed to be equitable, it needed to be fair, it needed to be just, particularly when we start talking about women's reproductive health. And so that's kind of a little bit of how we ended up on this term called reproductive justice, because we started to talk about how the healthcare needed to be holistic. It needed to take into consideration all of the various issues that impacted women in their day-to-day lives and prevented us from being able to access quality, affordable, and equitable healthcare. And from there, we took out the full-page signature ad with over 800 Black women signing on to it, including Alice Walker, supermodel Veronica Webb, and some other, Angela Davis, and some other folks who signed on to it, saying this is what Black women believe we need to be sure to include in any kind of health care reform plan in this country. But I kind of give you that background because I think it's important that if we're going to have a conversation about reproductive justice and health reform, that we all be on the same page about what reproductive justice really is. It's not an alternative term for reproductive health or reproductive rights. That's first and foremost. Instead, it's a framework that puts women and the lives of women at the center of the discourse. It recognizes the agency of women and the expertise that we bring to this movement and to this work through our lived experiences. Reproductive justice is about creating the conditions for all women, especially the women who are the most disenfranchised, to be healthy, have healthy families, and live in healthy communities. It means that every woman has the human right to have a child, that she should and must have access to the information and family planning methods to help her control her fertility, and that she receive the social and economic supports she needs to take care of she needs to parent the child or the children that she already has. So, if we're talking about working to ensure just and equitable health reform implementation through an RJ lens, it means we've got to ask some important questions beyond just access to abortion services and access to family planning and contraceptives. It's incumbent upon us to understand the intersectionality of race, class, and gender, and how the lives of women, especially women of color, are impacted within the context of health reform and the services that we need. For many of us, that means we must answer some important questions. For example, what will it take to reduce the health disparities of women, especially women of color? I was at Planned Parenthood of Illinois' Generations Gala last week, and Dr. Jocelyn Elders was the keynote speaker, and she said something that was very profound. She said, the best contraception is education. We seem to think that if we have as many methods of contraception as possible, if we can just make abortion more accessible, if we can do all that we can to reduce the rate of unintended pregnancy, that we have truly made a difference in the lives of women. And while it's true that women need a variety of contraceptive methods to choose from, and there certainly is no question that it's long past the time for the pro-choice movement to mount a serious effort around repealing the Hyde Amendment, these victories still would not completely enable women to lead reproductively healthy lives. For me, Dr. Elders could not have hit the nail on the head more pointedly when she said that the best contraception was education. At BWRJ, we know from our experiences working with women in the community that the lives of women are not just the sum total of our uteruses. We can't control what we don't know. Far too many women, especially women of color, don't understand the basics of how their reproductive system functions. And so if we really want to implement a health reform plan that speaks to the real needs of women and their families, we've got to start talking about how do we include comprehensive reproductive and sexual health education as a part of what we consider to be preventative health care. And notice I said reproductive and sexual health education, because there is a difference. Oftentimes we just talk about sexual health education, and so still we're just talking about preventing unintended pregnancies. But we've got to be talking about reproductive and sexual health education, because the reproductive health education brings in the education piece. It brings in that vital information that women need so that they can truly be reproductively autonomous, so that they can truly understand how to control their fertility, even using methods of contraception. So we've got to push for some certain things. First and foremost, I really think we need to figure out how do we support physicians in being able to provide the services that I believe and that all of us believe that they truly want to provide to the women that they see. We've got to move away from these 10, 15-minute visits with the physicians, and we've got to push for physicians and nurse practitioners to be allowed to, and other healthcare professionals to be allowed to spend the time that they need to with women, explaining to them about breast care, about understanding and how do you chart your menstrual cycle, how do you prevent reproductive tract infections by not using harmful feminine hygiene products like douching products, and the importance of using barrier methods of contraception like male and female condoms. We have to push for this education in our public school systems, in our faith-based institutions, and community health centers. That's preventative care to me. Even as we talk about healthy and preventative lifestyles, we've also got to include information and education about what healthy relationships look like. That's preventative care. I think that's especially important, and it speaks directly to this growing problem that we see with younger people, with younger women around dating violence, sexual assault, and domestic violence. These are all growing issues that we need to be talking about, and if we're talking about preventative care, that's what many young women of color need at this moment. Even in the area of diet, and if we're going to talk about reproductive justice, again, we got to think broadly, because that's what reproductive justice is about. Even in the area of diet and nutrition, if a woman is living on a meager amount of monthly public assistance, it's very difficult to purchase healthy, organic, and all-natural foods that would be more nutritionally beneficial to her and her family. We also have to deal with the fact that most communities of color are food deserts, and they lack major grocery stores that sell healthy foods. And I know that the First Lady is pushing this huge exercise initiative, and I think that's great. That's all a part of preventative care. But if we're talking about real preventative care in communities of color and with women of color, we've got to acknowledge that many women are afraid to walk down the street in certain communities. We are afraid to let our children go outside and play. I live in the hood. I live in the Greater Grand Crossing area. I live in an area that is 2 blocks away from an area, it's on 79th Street, but we call that the 9. And you don't want to be on the 9 at a certain time of the day or night. So I think we have to acknowledge these things when we're talking about healthy lifestyles and preventative care. What I'm talking about is a holistic preventative care, and we need to figure out how do we do that and include the day-to-day real-life realities in what we're working to have implemented. And as I said, at BWRJ, reproductive and sexual health education is high on the list of what we need to be pushing to be included in the basic health plan about what's preventative. Just personally, I've had 4 unintended pregnancies, and I've had 4 abortions. And it wasn't until a nurse practitioner took the time to explain to me my menstrual cycle How do I chart it? And to show me that I didn't have to be pregnant if I didn't want to. And similarly, around the use of feminine hygiene products, I could never figure out why I kept having recurrent vaginal infections or recurrent bacterial vaginosis. And it wasn't until that same nurse practitioner took the time to talk to me and tell me that, are you using feminine hygiene products? Are you douching? And it wasn't until she asked me certain questions to get down to why I was having recurrent reproductive tract infections. I was douching. I was douching after my period. I was douching after sex. I was douching before sex. We have to understand the culture and the habits of the communities, especially women of color, that have been deeply ingrained within us, particularly around the use of feminine hygiene products. Even in the area of breast cancer screenings. Now, some of you might disagree with me around what I'm getting ready to say, but in BWR's opinion, the U.S. Preventive Services Task Force recommendation to change the breast cancer screening guidelines was irresponsible at best and detrimental to women of color, especially Black women. Black women are 75% more likely to die of breast cancer than white women due to later detection. And many Black women are at even higher risk for triple-negative breast cancer, an aggressive type of breast cancer that affects Black women twice as frequently as white women. So my question is, given what we know about the challenges Black women face with breast cancer, why would the task force recommend that we further place the health and well-being of women in these high-risk populations at risk? Here in Illinois, BWRJ is the regional Illinois coordinator for Raising Women's Voices, which many of you all know is a national initiative working to make sure that the voices of women are heard and women's concerns are addressed as policymakers put the new health reform law into action. There's a ton of work that we need to do here in Illinois. Late last year, Illinois set up a healthcare reform website where comments could be submitted online as well as testimony. I saw the testimony of Illinois Maternal Child Health, testimony from Planned Parenthood, but there is a need to work to ensure that the council and our Health Insurance Commission broaden their scope of information and input solicited. Even in the council's document soliciting public comments, they didn't address or acknowledge racial, ethnic, or gender health disparities. One question from the document in particular fell under eligibility determination, and this section discussed eligibility for tax subsidies to help purchase private insurance on the exchange and public coverage, Medicaid, and all kids. And prominent in this section was the question of what should be in Illinois' basic health plan. And so we believe that this is an area that women's health advocates here in Illinois need to make sure that our voices are heard as strong as possible, especially to ensure that reproductive health services includes not just abortion, but comprehensive reproductive and sexual health education and contraceptives to make sure that these things aren't placed further out of the reach of especially low-income women who are disproportionately women of color. Now, the landscape of Illinois really demands that we have a state-created exchange that's sensitive to the unique problems that face Illinois residents. So, for example, the Chicago Department of Public Health reports that Illinois has some of the highest rates of gonorrhea and chlamydia in the country. And and this is the same for high rates of HIV and AIDS, especially amongst young people and seniors. Seniors is our new, growing population. Governor Quinn, who is supportive of the Affordable Care Act, established a Health Care Reform Implementation Council to recommend what exchange is best for the state of Illinois. But it's important to note that all of the council members were current executive directors of Illinois state agencies, such as the Department of Health but more importantly, there was no woman of color on the council. So then how do you really implement an exchange? How do you really create an exchange and implement healthcare reform that is going to speak to the needs of some of the populations that are the most impacted and have some of the highest rates of health disparities? They did issue a report, finally the council did, that was in support of a state-run health exchange, but we also have to be keeping an eye on legislation that is being introduced in the Senate and the House. So, for instance, we had Senate Bill 1549 and House Bill 1577. House Bill 1577 passed out of the House, but it's got to pass out of the Senate by May 27th, which is 2 days before the session adjourns. And the worst case scenario is that the Senate doesn't call the bill. But we all know that Illinois sometimes holds special sessions over the summer. We did have an anti-Affordable Care Act legislation introduced, House Bill 3225, which mandated that Illinois not comply with any federal health care reform until after all state challenges to the constitutionality of the reform are adjudicated or have been defeated. So where are we at in anticipation of the 2014 deadline, which is a deadline that at the federal level they've given that states, implement the exchange. So here in Illinois, our Illinois insurance commissioner has just been appointed to be the first executive director of the newly created Federal Insurance Office, which is a federal agency that monitors insurers but doesn't regulate them. So without an insurance commissioner to review, Illinois isn't able to create the necessary infrastructure for an exchange. One of the things that the commissioner would do is to eliminate insurers from conducting business if they have a state record of not paying out on claims. From our research, and that's some of the work that we're doing under Raising Women's Voices, as well as looking at which insurers currently cover abortion procedures, we've learned that most likely Illinois will house its health exchange within a state-run agency. The concern is that it will take on some of the already existing issues within the agency it will be housed in. Also, because of the large women of color population in Illinois, is merging the agency within another agency, will that address the great health disparities that were part of the motive behind creating the Affordable Care Act? In addition to working to make race, ethnicity, and gender equity a priority for the Council and the Health Insurance Commission, there is a need for us all to work together to protect the current reproductive health services that are already being provided to women in Illinois, as well as develop and work to get a statement of principles by which that exchange will operate. And there are some great examples by activists that were developed in New York and New Mexico under Raising Women's Voices. So where do we stand now as we wait for a new commissioner in Chicago? Well, we've had to shift gears and throw our capes on and deal with the conservative right's next strategy in their war on the bodies of women, which is still very much so connected to health reform. I think everybody here knows that on March 29th of this year, the Texas-based Life Always erected the first of 29 billboards, or the first of 29 billboards at the first of 29 locations in Black communities on the south and west sides of Chicago. And these billboards say that every 21 minutes, the next potential future leader is aborted, and have a picture of President Obama on there. These billboards are racist and they are sexist. The conservative right-wing groups behind the billboards, Life Always and heroic media have been holding fundraisers with Sarah Palin, with Mike Huckabee, and many of the government safety net programs that women need to take care of the children that they have, they fight against. They similarly are not supportive of healthcare reform, and they support efforts to repeal the Affordable Care Act. And in effect, want to turn back the clock on any progress that has been made for not just Black women, but all women to realize any kind of reproductive autonomy. Now, these billboards started in Atlanta. They've made their way around the country. And they have almost always been put up in African American communities. For me, the fact that Life Always would use the bodies of Black women as a way to further their own political agenda is unconscionable, in addition to being racist. Both groups were responsible for the billboards that went up in Soho in February. And the interesting thing to note about what happened in Soho is that the billboards stayed up for 3 days, roughly 3 or 4 days, and it was owing to the outcry from activists in New York that the billboards came down, but they also came down because it was found out that the mother of the daughter of the little girl on the billboard had not given her consent for her daughter's image to be used in that way. She took her daughter to a casting call, a modeling casting call, thinking she was just going to go do a photo shoot so that she could get some modeling work in the future. And then they used her daughter's image as a stock photo for these billboards. So we need to be asking, are they doing the same thing with some of the other billboards that have went up around the country? It's clear that their motives are questionable at best, as most of the billboards here in Chicago that were erected went up in the middle of the night. So when the first billboards went up on 58th and State Street, we drove by the night before and we saw, it was so dark out, I was thinking, oh my God, how can he see how to put the billboard up? But there was this guy standing up on the ladder, putting up these billboards. And the other thing that they did was that they had security sitting out watching the billboards. Well, now, if you have money to put up billboards, one, and to pay for somebody to sit out and watch these billboards, that money could go and really help the real issues that are going on in communities of color. But, given their message, if they were really concerned about potential Black leaders, we have to question why they don't talk about the social, economic, and political empowerment of the communities where they're placing the billboards up. Many of the billboards are on the side of vacant buildings that are facing garbage-filled lots. The Chicago Abortion Fund went and with some other groups from around Chicago and went and cleaned up the lot on 58th and State Street. But we have so many other garbage-strewn lots around the city in the African American community. And so groups like CAF and other groups can't be expected to take on the responsibility of cleaning up all the lots. If you have money to put up billboards and hire security, why don't you clean up the lots? The areas that they've placed these billboards in have high rates of unemployment, homelessness, and crime. So what kind of message are they really sending by placing billboards about the lives of Black children over heaps of trash? I'm confused. You're telling me that I need to stop murdering my children, but you put the billboard to tell me to do that over a heap of trash. What are you saying about me, my children, and the community where I live? I think it's further evidence of their lack of concern for Black women, our children, and our communities. Their own press statement that they released when they held the press conference at the first sight of the billboards, they said that the billboards were a part of a political agenda to target supporters of President Barack Obama. Well, first of all, I don't like the word target, because when you say target, that means you're trying to shoot somebody, but that's just me. But for me, and as I speak on behalf of Black Women for Reproductive Justice, the placement of these billboards in the Black community only further highlights their lack of cultural competency around what the real reproductive health disparities are for Black women. When they did the press conference, for them it was all about media attention. There were Black women who showed up at the press conference who were very vocal about our displeasure about them putting up the billboards. And when it came time for questions and answers, they refused to take any questions from us. And they said they were only taking questions from the media. Well, then you didn't come to talk to us. You came for a media moment. And you are not really concerned about what the real issues are confronting Black women, nor are you really concerned about the fact that Black women have higher rates of unintended pregnancy. Heroic Media is also responsible for several television ads that are being aired on Black entertainment television, which I don't know which is more offensive. The ad we have here, or their ad that says the most dangerous place for an African American is the womb. Because what that says is not only are you accusing me of murdering my children, but you're also telling me that my body is a dangerous place for my child. You're also saying that I don't care anything about my children, my community, and that I am unable to provide a safe place in my womb for my child. I can't help but be offended and insulted from that. Heroic Media describes itself as a pro-life media house that's focused on doing public education through media advertising, but the truth is they have two goals. One is to attack Black women, and also we know to slander Planned Parenthood as well. They pretty much hate everybody equally, and have wasted no amounts of money. They are so heavily funded, it is incredible. They, along with two other leading groups, one in Atlanta called the Radiance Foundation, and another one, Priests for Life, have a combined budget of $30 million that they are using to wage this attack on women. Last year, Sister Song, Women of Color Reproductive Health Collective, came together and called a group of Black women from around the country to figure out what were we going to do about these attacks, because they, of course, as I said, started in Atlanta. And so out of that meeting, this group called the Trust Black Women Partnership was created. TBW is a partnership of women from many different organizations, regions, and religious backgrounds that have come together to work to try and ensure that Black women have the human right to make our own decisions about our reproductive lives, and that we should never regret the difficult choices that we have had to make based on our complicated experiences. So BWRJ, as a founding member of Trust Black Women, agreed to be one of the Midwest regional anchor organizations in anticipation of the billboards coming here. We kind of knew that they were going to come, but we had no idea they were going to come with the message that they have. So we've really been leading the effort to speak out about the billboards here and to get them down. Some of the work that we are carrying out includes holding Black women speak outs, because we believe that it is important for Black women to speak for ourselves. We are having speak outs where Black women can share their stories about what the real issues are in our lives, and that of the African American community. We're pivoting from their message around the high rates of abortion amongst Black women, and saying instead we're speaking truth to the fact that yes, Black women have higher rates of unintended pregnancy, but that the real conversation that needs to be had, with Black women playing a leading role in the discourse, is what can we do to reduce the number of unintended pregnancies? And what do we need to do to ensure that Black women have access to the health care that they need for themselves and their families so that they can lead healthy lives? What do we need to ensure that Black women have access to healthy foods that are nutritionally beneficial for themselves and their families? What do we need to do to deal with the issue of violence in our communities? Because for me, that's a public health issue. That's a health issue. That I can't walk down a certain street in my community at a certain type of the day or the night is a health issue. It means that people can't get out and get the fresh air that they need. It means that children can't go out and play and enjoy the communities that they live in. Those are health issues. As I think about the impact of health reform on women of color within a reproductive justice context, I would encourage us all to question the motives behind why groups like Life Always and Heroic Media and the Radiance Foundation have now come out with these campaigns right during the time when we're talking about healthcare reform and implementation of healthcare reform. We have to question the motives behind why members of Congress would try to repeal health reform with the knowledge that it would deny millions of women of color access to affordable and quality healthcare services. Why would they force women to carry unintended pregnancies to term by passing the No Taxpayer Funding for Abortion Act? Why are they attacking the bodies of Black women and accusing us of murdering potential future Black leaders? And what are the connections between these efforts and things like the prison industrial complex? What are the connections between, as author Michelle Alexander has so accurately termed it, the new Jim Crow? What do we need to be looking for? What are the connections between the educational system and the prison pipeline, especially for young people of color? These are all questions that I think we must bring to the table as we seek to further implementation of quality and equitable health reform. But the most important question we all have to be asking is, why are the lives of women of color so unimportant in this conversation? So, thank you. And I brought a whole bunch of flyers about the three speak outs. I hope people will take some. Can I leave some out? I'll leave some outside, and if you can come, please, we encourage you to come. The first one is Wednesday, May 18th. There's one on June 1st and one on June 9th, all across the south side of the city. We're working with Planned Parenthood to try and organize one on the west side in Austin where there are billboards. If you know of Black women who might want to tell their stories, please have them contact us. We would welcome them telling their stories. There'll be light refreshments, and this is the time for Black women to be organizing and mobilizing like never before. Because one of the things that I've been doing this work since 1990, one of the things that, having done this work for so many years, one of the things I know is that if we can get it right for Black women around this, and Latina women, and Indigenous and Native American women, if we can get this right for women of color, we all win.